there will be people, no matter what evidence you present, what studies you do, they will not want to take it. And there are many reasons why they may not want to take it. It may be that this vaccine is too new. It came on the market too quickly for some. And I understand that the conventional medication takes anywhere from 7 to 10 years to hit the market. It's vetted very well. A lot of studies are done and all of that. I get it. But we have a scenario now where COVID-19 is killing people at an alarming rate. Something has to be done now. If we wait 7 to 10 years for a vaccine for COVID-19 to come out, oh my goodness.
It certainly is understandable to feel that the development of this vaccine was too fast. It really was a remarkable feat. However, technology is a remarkable feat in and of itself. We have the technology to do this now in a way that we've never been able to do this before. In many ways, technology in several other realms of life is also pretty amazing, especially what we do with driving cars, with our phones. And medicine is very much the same, although people, I don't think, very often think of it that way. But medicine is a reflection of our ability to take advantage of the technologies that have been developed.
This did happen a lot faster than I think a lot of people planned on it. But I think to find your answer as to why it happened so fast, you really have to look at what kind of vaccine that we're talking about, right? So normally with vaccines, it's you have to grow out the virus, you got to kill it, and then you got to take away the parts that can make people sick, and then you got to break that down and package it just right so you could give it to people and then they can get a vaccine, right? But the vaccine that we're talking about with coronavirus works a little bit different. It's all really down to genetics. When you're just trying to replicate DNA, you can do that really fast. You don't have to grow out the whole organism. It's just a matter of putting little blocks together in a lab setting. And that's how this vaccine works. It's a little bit of genetic information that is going to teach your body how to make pretty much practice dummies. So whenever you do get sick, your body's already prepared for it. And then when you think of all the energy and effort they put into this, think about it. There's a lot of diseases out there, right? And everyone's trying to get money for breast cancer. Some people are trying to get money, for lupus. Some people are trying to get money for AIDS and things. And everything's split. But with this coronavirus situation, the whole world was sick. Everyone wanted an answer immediately. So you had governments and everyone just pouring money into this resource, which left a lot of time, a lot of energy, a lot of availability for people to work as hard as they could to fix this thing. So when you combine the funding that went into it, the urgency that went into it because the whole world needed it, and then just the technology behind it where it's so much quicker to work with genetics as opposed to growing out the whole virus and then having to kill it and do all that, you're going to have a vaccine that comes out quicker.
It's good for people to know that this particular virus is novel in some ways, but it belongs to the same class of viruses that the common cold belongs to, the coronaviruses. So scientists have been studying this virus for more than 50 years, and they already knew a whole lot about it before this particular strand came out.
I honestly had my own questions when it first came out. When my clinic was starting to offer it as a resident working in the hospital and then also in the clinic, which are two different institutions, they automatically had everyone signed up for the vaccine at the hospital and you could opt out. At that time, I was coming off night flow. I was like, oh, I don't even know what's happening right now. I was sleep deprived. And I was like, I don't know much about the Pfizer vaccine, which was the one that the hospital was giving. And I was like, you know what? I'm going to opt out right now. And I want to do my research so that I can be informed and I can make the best decision for myself. I did get the vaccine. Did it hurt? No, I didn't feel anything. I think the second vaccine, I felt more muscle pain afterwards. And I would say the headache was a bit more intense than the first headache was. And I had heard a lot about how people were just feeling really sick and they couldn't get out of bed for a day or two. And I was so scared of that happening to me because I got the second vaccine the day before I was supposed to start in the hospital. I was like, oh my gosh, like if I get really sick, like I'm not going to be able to go to work and I'm going to feel bad because somebody's going to have to come in and replace me in the hospital and work on my behalf. And I had a really, really bad headache that night that I got the second dose. I took some ibuprofen, went to sleep, and I felt fine afterwards.
I was able to get the vaccine, it was December 28th. 4 weeks later, I got the second part of that vaccine. Now, one thing about me, whenever I get a vaccine, whether it's the flu vaccine or a tetanus booster, anything like that, for me, I always get a little, a little pain at the injection site. I know this about me. I usually get a little headache. I usually feel a little weak. That's me. I have always been like that, and certainly, quite honestly, this time around with the COVID-19 vaccine, again, I got the injection. I was a little sore at the arm, but that was nothing new. I felt a little headache. That was nothing new. I felt a little weak, for a day or two. That was nothing new. No, I didn't get sick with COVID, no. This vaccine does not give you COVID-19 infection, no.
No, the vaccine doesn't have any COVID in it. The vaccine, those symptoms that you get after receiving the shot is your body's immune response to something being injected in you. But the COVID vaccine does not have any COVID in it. It has messenger RNA.
mRNA is basically genetic information that tells our body how to make proteins.
Yes, I got both shots of the vaccine. I got one in December and then one at the end of December and then the second one at the end of January. No, it didn't hurt. I mean, whenever a needle touches your skin, even if you're sewing and you prick yourself, it hurts. So, yeah, I mean, when this needle touches your skin, but it's only a second. I mean, boom, bam, they give you the vaccine really quickly and it's done. First one, you just have that raised kind of lump on your arm and it's a little warm. The second one was the same, but then the symptoms were probably about 18 hours afterwards or whatever like that. I felt, tired. And then after I had it on Friday and by Sunday I was fine. It just went away.
I got the coronavirus vaccine back in December, like mid-December was my first dose, and then my second dose was early January. Like, I really don't get a lot of pain with injections. There was some soreness right here, after the first couple of days, but that was really the height of the side effects that I had, just sore arm. No, you can't say it didn't work. I think, for me, I honestly don't really get a lot of side effects with much of anything. It always impresses my wife. I've eaten way too many things that I shouldn't have and not gotten sick at all from it.
I'm very fortunate to have had the vaccine. Actually, getting the vaccine did not hurt at all. The second dose, I had slight increase in pain in the arm, but really nothing different from most other vaccines. You should have some reaction. Some people have stronger reactions than others, but it doesn't mean that it's working better in people who have a stronger reaction than those who don't.
Well, a lot of people are taking the wait and see attitude. They say, I'm not going to be the first to do anything, but I won't be the last either. I'm going to wait and see what happens to other people, friends that I know of who are getting it. And I think that's okay. I wouldn't wait too long.
How long are you going to wait for? Is the wait going to be long enough to, 4 weeks from now you get coronavirus and you're hoping you just make it through those 14 days without ending up on a ventilator?
None of us want to be a lab rat.
If you're worried about being a lab rat, as you put it, look at us. As soon as I could get the vaccine, I got it. And that was more so to show people like you, my family, my friends back home, my wife, that it was safe.
Healthcare workers and essential workers have really put themselves at the forefront of this and have been the first to really receive it on a general scale. What I'm saying is there have been many before you.
We need to take advantage of the opportunity of having this vaccine as African Americans and as people of color as best we can. And the reason is because we have been impacted so much more severely by this disease.
People of color in our community, and in general, I will say in general, are disproportionately have a higher rate of. You can fill that in with just about anything. Cancers, diabetes, hypertension, cardiovascular disease. Now you add to it yet another weapon of war, which is this COVID-19, which is taking advantage of anyone it can come in contact with, and it hits hardest, especially the people who have these comorbidities. And who are they? Well, disproportionately, the higher rate of comorbidities are found in people of color right here in our community.
African Americans die from everything the most. We have the cancer. We have all these different things that we have. Why do we have to die from this one as well? So if there's other people that are lining up, other people are coming to our community to get the vaccine, why are not we getting the vaccine?
One thing about COVID is it's affected different people. Some people that haven't had any, health issues. More recently, I was in the intensive care unit caring for patients, and I had a patient that was severely affected, had to be intubated, and he had no health conditions at all.
I know people who've had COVID-19 and they walked away as if nothing ever happened. I know people or knew people where I've gone to the funerals for them because they had COVID-19. And I know people in the spectrum in between as well. There's no way to tell if you're going to do well or not once you're infected with this. Personally, I have no health history. I take no medication, never had to. No hypertension, no diabetes, no sickle cell anemia, nothing. I don't drink alcohol, don't do drugs, never did. I'm in reasonably good shape. So I should have done well if I had COVID-19, but guess what? I was in the intensive care unit, swirling the bowl and getting ready to die. You just don't know.
Personally, I had one family member that did get COVID, but she only had mild symptoms for about a week or so, and then she was much better. But I did lose one patient where a family member brought it home because she, doesn't work and stuff, and so I had one patient that did die from the COVID.
Unfortunately, I've had people in my family, I've had some patients, and I haven't had colleagues that have died, but they were seriously ill and came very close to dying.
I've lost more patients than I care to talk about. We have as a health center. It's really been something devastating that, again, thankfully, not everyone had to see. But those of us that were in the hospital, especially during the first surge, back when this all was brand new and we didn't really know a lot about what was going on, it definitely leaves an impact on you.
I mean, what's old nowadays? The patient was maybe like 60, but we've also had patients that are 40 that die, More recently, I had a patient who is my own patient, and her grandchild died, and he was 10 months old due to COVID. And so I know that COVID hasn't affected children as much.
Want to look at, what are the risks of the vaccine? What are the risks of the virus? Let's be real about it, okay? The risk of the vaccine is you can get a sore arm like I did. You might get a fever, might get some headache, might feel a little crappy for a day or two. And then you get better, you get over it. And then the hope is that you won't get real sick with coronavirus should you run across it. You get coronavirus, you could probably lose your sense of smell and taste. That's just annoying. Then you could also have really bad shortness of breath. Your body, because it's fighting the whole virus, can then have a type of reaction to where you just get so much inflammation, it can hurt your lungs even more, and that's how people are ending up on ventilators. It could affect your kidneys. We've had people that go into kidney failure with coronavirus. It could, even if you get through coronavirus, leave you with some lingering effects, whereas you just feel fatigued for months afterward, or you just kind of feel more short of breath than you normally would have.
there are long-lasting effects after getting COVID. It's just not like a cold, you get it and you're over with.
COVID-19 has such a vast range of possible symptoms, from no symptoms at all, life is lovely, to death.
We really do not have very good therapy for this disease, and people are still dying. There is no cure, and the treatment is primarily supportive care.
No matter what illness we're talking about, whether we're talking about coronavirus, diabetes, depression, or just a common cold, you always want to prevent as opposed to having to treat something. And that's because, good therapies or not, nothing is ever 100% guaranteed that a therapy is going to work.
We try to give steroids to help decrease the inflammation. We try to give an antiviral medication to try to decrease the burden of the COVID virus in the body. But can I say that all of those things work? It's not like I give it and then they automatically get better. Some people it helps, some people it doesn't. And it's like, once we get to those points, I mean, all we can do is really provide support. You know, when we intubate somebody, we're providing support. When we do, plasma exchange and, we're trying to circulate the blood, or we're doing ECMO, which means basically you have a machine acting as the heart and the lung. All of that is really support. I have no treatment to cure COVID.
Yes, you do get some immunity from having the COVID, but you don't know how much.
One thing that we don't know for everyone, and everyone is different, is how long do you have immunity for? And I think, right now, at this point in time, we're saying like 90 days, maybe longer for some people. That might be 6 months. That might be 9 months. That might be a year. Who knows? Unless you're continually to get tested to see if you have immunity or not. And so I think, because we don't know, some people do get COVID a second time.
The second time I had COVID-19, yes, I had it twice.
Yeah. I've had some patients come into the ICU, and they had the infection maybe about 2 or 3 months before. They're positive, tested negative. Actually, this particular patient that I think about is funny, because he was just very adamant that he did not have COVID. But he went to the DR, and then about 3 or 4 days, of coming back from the DR, he was having significant shortness of breath, was requiring oxygen. We retested him, and he turned out to be positive. And so we can only assume that, he got COVID a second time. And unfortunately for him, it wasn't great, because he didn't have a outcome. He ended up passing away.
Just because you had COVID doesn't mean you can't get it again. We have had people that have had multiple bouts of coronavirus. So eventually that natural immunity that you might have right now is probably going to fade. So this vaccine will give you an extra boost to that.
Do we know how long the immunity will be with the vaccine? I don't know. I have to follow the science and see what they come up with. It's possible that just like the current flu vaccine that we have, it's possible that we may need to get a COVID-19 vaccine every year. We don't know yet. We may need a booster.
You don't want to have COVID to get the immunity, because you don't know whether you're one of the people who will be sick for 1 or 2 weeks, or the person who's going to be very sick and end up in the hospital.
The whole point of vaccines is to get your body to do the cool thing that it does naturally and build a response without you actually having to get sick from it.
The fact that people are so mistrusting of this vaccine, but are also very mistrusting of our entire medical system, is one which is only human nature, given our past, given our history.
There hasn't really been a good history in this country of science or the government really doing what's best for Black and brown communities, right? A lot of us know about the Tuskegee experiment, where they asked a bunch of Black farmers to do this study on syphilis, not really telling them that, like, yo, we're gonna give you syphilis and not do anything about it. But because of all those things, that's part of the thing that drove me into healthcare. to change that?
Back when that happened, I believe there were not any black doctors that was among those doctors that were doing that. There was a black nurse that was, there, but, nurses didn't have the autonomy that they have now. When I talk to the patients now, they ask me, should they get the vaccine? There's some trust now where we're at the table, we're among the researchers, people of color, people from other ethnic groups.
There are people like me and who look like me who fortunately are able to become the healthcare providers.
In fact, one of the scientists involved in developing the vaccine was a woman of color.
I have heard people make comments such as they're afraid that the DNA or the RNA of the virus might get into their DNA or the vaccine causing a plate. And I can't imagine where that is coming from. I know no way that is possible.
This is a vaccine that presidents have taken, other doctors have taken, that people from like rich areas and stuff are like trying to disguise themselves as grandmamas to come in and get, so like if all of those conspiracy theories were true and this was like some subverted plot to really just take down Black and brown communities, not so many people would be clamoring for this thing. No, I'm not being paid by the government with microchips. There are no microchips in the vaccine.
It's very, very hard not to see your family. It's one thing to give up a vacation, which actually can be difficult if you haven't had a vacation for a long period of time. But it's exceptionally difficult not to see family. And I think that's why we had such a huge surge in the disease, certainly after the holidays when people went to visit their family. I just remember I had plans to see people who I was afraid were going to die if I didn't see them because they were older. And there was a part of me that said, but if I don't go and they die, I'll be so upset that I didn't see them. At the same time, I didn't want to put them at risk.
This pandemic has taught us, if nothing else, that relationships are so important, and reaching out to people and being around people and being edified by people.
The children not being in school is really affecting some of them a lot. Some children who don't mind, they like using the computers and things like that. My grandson loves it, but I think that he may have a hard time when he goes back to school and he's not using the computer. But then there's other children that are tired of using the laptops. They're tired of being on a Zoom. I'm tired of being on Zoom. This is not normal life for children. Children play with each other. Even if they don't know each other, they get together and they play, they talk. They don't even know. I ask them, what's his name? I don't know. We were just playing.
I think the vaccine really allows us to get our freedom back to go out and interact in the world and participate in activities and life in a way that we used to do without having to worry about potentially exposing other people and also exposing ourselves to a potentially deadly disease.
Because I want to take off this mask one day. I want to be able to go to the mall, and you know how many people are in the mall. You want to go to outside, you want to go to events like a football game, and you want to be able to go to the concession. You want to get into an elevator with more than one person. So, going to the theater, going to either a live show or either going to the movies. Some being in a group, being in a room with more than 3 people, that's what I really want to do. But mostly to travel to see my family. That's, to see them.
I openly discuss COVID-19, the vaccine, and the importance of taking advantage of getting the vaccine when available with all of my patients. I try not to say you absolutely have to get this vaccine because, as I said, I think everybody has to weigh their own personal benefits and risks. But I've had huge numbers of people completely change from I will not take this vaccine to posting on Facebook that they just had the vaccine like 2 weeks later.
Honestly, I get worried when I tell a patient what I want to do, or I give a plan and they're just like, yeah, sure, whatever you say, because I want people to be engaged. I want people to understand why things need to get done. I don't want it to go in one ear and out the other. So, if you are hesitant right now, if you are unsure about the vaccine to prevent the virus, I think that's totally human. Like, we were given brains for a reason to question. What I would encourage you to do is to really look for the truth. You could ask a doctor, you can ask people that have been working against this virus for the past year, or you can go get some random thing that came from who knows who on Facebook or something like that.
As adults, we have a choice. So all we can do is just, tell you the results, tell you what the clinical trial said, tell you my experience, answer your questions, but you really need to educate yourself as well too, and read reputable material on the vaccine and the response.
I've got a lot of faith in the vaccine. Again, like I mentioned before, with this virus, it's something new that those of us that are younger and, and haven't been around as long had to really grapple with dealing with the disease that's new. But we also didn't know what it was like to live through a time where there was a disease that was going crazy, a vaccine came out, and people don't have to deal with that anymore. Like, no one in America really gets polio anymore.
And that was something that was around in the 50s a lot. And I don't believe that there's, if we have to look up, probably see what percentage of anybody getting polio, because there was a mass vaccination for that. I remember getting that as a child.
The vaccine is to try to prevent the infection and the spread of the infection as well, right? And so when we get vaccinated, it's not always just for us. It's also to help other people in our community. And so I think keeping that also in perspective is really important. And so, one of my reasons in getting the vaccine is, one, yes, I'm exposed every day to COVID, but also I have a husband and I have family that I want to be able to go see. And me getting the vaccine also is to try to protect them as well.
I've always believed in leading by example. We can talk as much as we want. We can try to educate as much as we want. We can try to show people as much as we want. But the buck stops here. The proof is in the pudding. I was the first one to get a vaccine here at this clinic. I don't think anything else has to be said after that.